Hello everyone, now let us discuss about 2023 CPT coding guidelines for male genital system part 1. Now coming to the first topic, that is perineal incision followed by destruction, excision, introduction, repair and manipulation. The CPT range for incision is 54000 to 54015 and CPT range for destruction is 54050 to 54065. And for excision it is 54100 to 54164. For introduction it is 54200 to 54250 and for repair it is 54300 to 5440 and finally manipulation it is 54450. First of all, coming to incision CPTs. For abdominal perineal gangrene debridement, we need to refer the integumentary system codes 11004 and 11006. Here the first CPT is 54000, 54,000. Slitting of prepuce, dorsal or lateral. Newborn. It is a separate procedure and do not report 63 modifier in conjunction with 54000. The next is 54001. Slitting of prepuce, dorsal or lateral except newborn. The next is 54015. Incision and drainage of penis deep. The next is 54050. Destruction of lesion penis, example condyloma, papilloma, molluscum contagiosum, herpetic vesicle, simple by chemical method. The next is 54050. Destruction of lesion by electrodesiccation. The next is 54056. Destruction of lesion by cryosurgery. The next is 54057. Destruction of lesion by laser surgery. The next is 54060. Destruction of lesion by surgical excision. The next is 54065. Destruction of lesion penis, example condyloma, papilloma, etc. This is previously it is simple, now it is extensive. Destruction of lesion simple means 54050. Destruction of lesion of penis extensive means 54065. The next is 54100. Biopsy of penis. Next is 54105. Biopsy of penis deep structures. The next is 54110. Excision of penile plaque. The next is 54111. Excision of penile plaque with draft to 5 cm in length. The next is 54112. Excision of penile plaque with graft greater than 5 cm in length. The next CPT is 54115. Removal of foreign body from deep penile tissue. Example, plastic implant. The next is 54120. Amputation of penis partial. And for complete, the CPT is 54125. The next is 54130. Amputation of penis radical with bilateral inguinofemoral lymphadenectomy. The next is 54135. Amputation of penis radical with bilateral lymphadenectomy in continuity with bilateral pelvic lymphadenectomy, including external iliac, hypogastric and obturator nodes. Next is 54150. Circumcision using clamp or other device with regional dorsal penile or ring block. Do not report 63 modifier in conjunction with 54150. And report 54150 with modifier 52 when performed with dorsal penile or ring block. Report 54150 with modifier 52, which is nothing but reduced services when performed without dorsal penile or ring block. The next is 54160. Circumcision, surgical excision other than clamp, device or dorsal slit, neonate, 28 days of age or younger or less. The next is 54161. circumcision, surgical excision other than clamp, device or dorsal slit, neonate older than 28 days of age. The next is 54162, lysis of excision of penile post-circumcision adhesions. The next is 54163, repair of incomplete circumcision. The next is 54164, frenulotomy of penis. Now let us see an example. Circumcision with adjacent tissue transfer was performed on a 2 months old. 2 months means approximately 60 days old. So first you will code the tissue transfer code 14040. Adjacent tissue transfer or rearrangement, cheeks, chin, mouth, neck, axilla, genitalia, hands or feet, defect 10 square centimeters or less. Followed by circumcision CPT 54161 along with 51 modifier to indicate multiple procedures. Circumcision, surgical excision other than clamp, device or dorsal slit, neonate older than 28 days of age. Now coming to introduction CPTs, the first one is 54200, injection procedure for perineal disease. The next is 54205. Injection procedure for perineal disease with surgical exposure of plaque. The next is 54220, irrigation of corpora cavernosa for priapism. The next is 54230, injection procedure for corpora cavernoscopy. The next CPT is 54231, dynamic cavernosometry including intracavernosal injection of vasoactive drugs, for example papaverine and phenethylamine. The next is 54235, injection of corpora cavernosa with pharmacological agents. The next is 54240, penile plethysmography. The next is 54250, nocturnal penile tumescence or rigidity test The next are repair CPTs. The first one is 54300, plastic operation of penis for straightening of chordae with or without mobilization of urethra. The next is 54304, plastic operation of penis for correction of chordae or for first stage hypospadias repair with or without transplantation of prepuce and or flap skins. The next is 54308, urethroplasty for second stage hypospadias repair, including urinary diversion less than 3 centimeters. If it is greater than 3 centimeters, the CPT is 54312. The next is 54316, urethroplasty for second stage hypospadias repair, including urinary diversion with free skin graft are obtained from the site other than genitalia. The next is 54318, urethroplasty for third stage hypospadias repair to release penis from scrotum. The next is 54322, one stage distal hypospadias repair with or without chordae or circumcision with simple meatal advancement. The next CPT is 54324. It includes one stage distal hypospadias repair with urethroplasty by local skin flaps. The next is 54326. With the urethroplasty by local skin flaps or mobilization of urethra. The next is 54328. This is also one stage distal hypospadias repair with extensive dissection to correct chordae and urethroplasty with local skin flaps, skin graft patch and or island flap. The next is 54332. One stage proximal penile or penoscrotal hypospadias repair requiring extensive dissection to correct chordae and urethroplasty by use of skin graft tube and or island flap. The next is 54336, one stage perineal hypospadias repair requiring extensive dissection to correct the chordae and urethroplasty by use of skin graft tube and or island flap. The next is 54340, repair of hypospadias complication. For example, fistula, stricture, diverticula by closure, incision or excision, simple. The next is 54344, repair of hypospadias complication requiring mobilization of skin flap and urethroplasty with flap or patch graft. The next is 54348, repair of hypospadias complication requiring extensive dissection and urethroplasty with flap, patch or tubed graft, including urinary diversion when performed. The next is 54352, revision of prior hypospadias repair requiring extensive dissection and excision of previously constructed structures, including re-release of chordae and reconstruction of urethra and penis by use of focal skin as graft and island flaps and skin brought in as flaps or grafts. The next is 54360, plastic operation on penis to correct angulation. The next is 54380, plastic operation on penis for epispadias distal to external splinter. The next CPT is 54385, plastic operation on penis with incontinence. The next is 54390, plastic operation on penis with extrophy of bladder. The next is 54400, insertion of penile prosthesis non-inflatable, semi-rigid. If it is inflatable, the CPT is 54401. And for removal or replacement of penile prosthesis, you need to refer 54415 and 16. The next is 54405, insertion of multi-component inflatable penile prosthesis including placement of pump, cylinders and reservoirs. And for reduced services, report 54405 with modifier 52. The next is 54406. Removal of all components of a multi-component inflatable penile prosthesis without replacement of prosthesis. And next is 54408. Repair of component of a multi-component inflatable penile prosthesis. The next is 54410, removal and replacement of all components of a multi-component inflatable penile prosthesis at the same operative session. The next is 54416, removal and replacement of all components of multi-component inflatable penile prosthesis through a infected field at the same operative site, including irrigation and debridement of infected skin. The next is 54415, removal of non-inflatable, that is semi-rigid or inflatable penile prosthesis without replacement of prosthesis. The next is 54416, removal and replacement of non-inflatable or inflatable penile prosthesis at the same operative session. The next is 54417, removal and replacement of non-inflatable or inflatable penile prosthesis through an infected field at the same operative session, including irrigation and debridement of infected tissue. The next is 54420, corpora cavernosa saphenous vein shunt, unilateral or bilateral. The next is 54430, corpora cavernosa corpus spongiosum shunt, unilateral or bilateral. The next is 54437, corpora cavernosa glands penis fistulization. Example, biopsy, needle, winter procedure, ronger or punch for priapism. The next is 54437, repair of traumatic corporeal tear. The next is 54438, replantation, penis, complete amputation including urethral repair. The next is 54440, plastic operation of penis for injury. The next is manipulation code 54450, foreskin manipulation including lysis of prepucial adhesions and stretching. Let us see an example. Patient with erectile dysfunction is presenting for penile implant. A non-inflatable penile prosthesis is inserted. So here the CPT is 54400. Insertion of penile prosthesis non-inflatable. Now coming to CPTs for testis. Now coming to testis, it is again subcategorized into excision, exploration, repair and laparoscopy. The CPT range for excision of testis are 54500 to 54535. Exploration are in the range 54550 to 54560. 54550 and 54560. Next, repair is in the range 54600 to 54680 and laparoscopy is in the range 54690 to 54699. Now coming to first CPT for excision. 54500 biopsy of testis needle. And for biopsy of testis incisional, the CPT is 54505. The next is 54512 excision of extraparenchymal lesion of testis. The next is 54520 orchiectomy simple including subcapsular with or without testicular prosthesis, scrotal or inguinal approach. The next is 54522 orchiectomy partial. Orchi means testis, root word for testis. The next is 54530 orchiectomy radical for tumor inguinal approach. The next is 54535 orchiectomy radical for tumor with abdominal exploration. Now coming to exploration codes. 54550 exploration for undescendented testis, inguinal or scrotal area. And for bilateral procedure, you need to report 54550 along with 50 modifier. The next is 54560 exploration for undescendented testis with abdominal exploration. Next, coming to repair CPTs. The first one is 54600 reduction of torsion of testis surgical with or without fixation of contralateral testis. Next is 54620 fixation of contralateral testis separate procedure. The next is 54640 orchiopexy inguinal or scrotal approach. And for bilateral procedure, report 54640 with modifier 50. The next CPT is 54650 orchiopexy abdominal approach for intra-abdominal testis. For example, Fowler, Stephens, and for laparoscopic approach, you need to use the CPT 54692. The next is 54660 insertion of testicular prosthesis. The next is 54670 suture or repair of testicular injury. The next is 54680 transplantation of testis to thigh because of scrotal destruction. Now coming to laparoscopy. Whenever we discuss about laparoscopy, surgical laparoscopy always includes diagnostic laparoscopy. And in order to report diagnostic laparoscopy, separate procedure, you need to use 49320. So here the first CPT is 54690, laparoscopy surgical orchiectomy. The next is 54692, laparoscopy orchiopexy for intra-abdominal testis. The next is 54699, unlisted laparoscopy procedure testis. Now let us see an example. Patient has a surgical torsion of right testis done with a orchiopexy of both testis. These were descended testis with scrotal approach. So here reduction of torsion is done with or without fixation of contralated testis. Opexy is nothing but fixation, orchiopexy of both testis. So here fixation of testis is done along with surgical torsion, reduction of surgical torsion. So the CPT is 54600, reduction of torsion of testis, surgical with or without fixation of contralateral testis. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.